Dr. Christina Conolly, and welcome again to our MCPS video series, Waymaking. Our goal is to help families make their way through many of the emotional challenges that we are faced with today. This video is a part of our Courageous Conversation series that we are having. We are talking about tough conversations that may make people feel uncomfortable, but are vital as we cope during the pandemic. I have with me today Dr. Kisha Davis, who is a medical doctor that practices family medicine. Thank you for joining us today.
Thank you, Dr. Connolly, for having me. It's a pleasure to be here.
Yes, glad to have you. So our first question today is, can you share a little bit about your medical background and the services that you provide around the county?
Sure. So I'm a family physician, and I provide primary care to patients over the course of their lifespan, or from womb to tomb, as we like to say. So taking care of chronic disease, preventive care, as well as acute needs. I'm currently working to support practices in Maryland, West Virginia, and Virginia. Prior to that, I served as a primary care physician at a practice in Gaithersburg. I am a Montgomery County native and a product of Montgomery County Public Schools. My sister and I, who is also a family physician, we co-host a podcast together called The Sisters Will See You Now.
Awesome. Great. So thank you for that. All right. So let's go and dig right into the tough conversation. So doctors around the country are providing telehealth services to their patients, either due to social distancing concerns or even anxiety from patients with leaving their homes. Can you describe what a telehealth session is and how can someone prepare for a telehealth visit with their doctor?
Sure. So telehealth is when you conduct a medical visit with your doctor through a video chat. And because of COVID-19, the government has liberalized the ability to do that and to be able to conduct those visits on a variety of platforms, even on the telephone, which is something that we could do before, but in a much more limited way. And there's so many conveniences to being able to see your doctor in that way, not having to drive to the office, wait in traffic, wait in the waiting room. And while we expect that some of those restrictions will come back after we kind of get through this public health emergency, telehealth is likely here to stay. So, when you're trying to prepare for a telehealth visit, the first thing you want to do is to find a good place to do it. So a place that has pretty decent lighting, some place where there's not a lot of background noise. If you're going to be discussing private matters, you want to be in a place where other people aren't going to interrupt. Don't worry if your house is a mess, your doctor isn't looking at that. And don't worry if you don't have the perfect background, your doctor doesn't care about that either. They do want to see you, so make sure the lighting is pretty decent so that they can see you. Beyond that, you want to prepare for a telehealth visit in much the same way you would prepare for a regular visit. So start by gathering all of your medications and have them close by you so that you can either read off of the name or be able to even better to show that pill bottle to your doctor. I don't know how many times a patient will come in and I ask what they're taking and they say the blue pill and the white pill and the red pill. You say, show me the bottle. That can be really helpful. The doctor might also want you to check your vitals. So if you have a blood pressure cuff, a scale, even a temperature, and if you are able to check your pulse, those are things that the doctor might want you to do actually in front of them or have done beforehand and be able to share those results with them. So if you have that equipment, be prepared to do it and share it. The doctor might also ask you to do some physical exam on yourself. So they might ask you to, press on your neck to feel lymph nodes or to breathe into the phone or into the computer so they can check your breathing. They might ask you to, press on your ankles to see if there's any swelling in your legs or, press on your belly to see if there's any pain. So don't be surprised to do that. If they ask you to do that, sometimes a flashlight can be helpful. Shine a light in your throat and they can see the back of your mouth and be able to see your tonsils. And the last thing, just like any other doctor's appointment, you want to come ready with your questions, your concerns, and any updates on any of your chronic medical conditions or concerns that you have for the call today. And so having all of that ready and preparing for that visit helps it go smoothly and make sure that you leave with all your questions answered.
Right. Well, thank you. Yeah, I remember having my first telehealth visit, and they were like, "Remember to have your ID." And I was like, "What do I need my ID for?" And they're like, "You got to hold it up to the camera so they make sure it's you." So, and then when we help make the virtual counseling procedures. We have to follow the HIPAA guidelines too. And it was like the same thing. I was like, oh, that's what it's for,
Yeah,
so to make sure you verify who the patient is and stuff like that. So, but yes, and I would definitely agree. Being able to do it from the comfort of my home was awesome. I
yeah,
didn't have to drive up
yeah.
to 70. So
We need
yes.
to know you are who you say you are. And after that, just talk to them like you know them.
Right. So thank you for sharing that. Because I know there's probably some people wondering, like, wait, what is this? Because they're not used to doing it. So thank you.
Yeah.
Uh, and so my next question is, so that we are hearing about family members that have become sick from COVID-19 during this time. And some of those family members can be the parents of children. So, but what advice do you have for people to help them to navigate how to support their family if they no longer can due to illness?
Yeah, I think that's such a great question that you brought up, because we do so much to prepare for our kids' future, right? To get them ready for college, we put them in sports, we have them play instruments, all of these things so that they can just, be their best self. But we often don't, where we lack is preparing them for a future where we might be sick or even not present. And so we're going to have a little bit of a courageous conversation today and think about, if you were to get sick with COVID-19 or some other illness and had to spend an extended amount of time away from home, who would care for your children? We often say it takes a child. So who's your village? And do those people know that you're in your village? Do they know that you would want to call on them? If something were to happen to you. And I'll share my own kind of personal story. So I was finishing up my residency, and my husband and I met with a financial counselor, and he encouraged us to get a will and healthcare directives. And I really wasn't expecting that. I was in my 20s, I was healthy, and we did have a young son, but it really just was not on my radar to even think about something like that. And it's like, well, you have kids, you want a future for them, and it's time to start having those conversations even when you're young. And that was kind of like a wake-up call for me. And I think for all of us, really, even just going beyond who will feed and clothe your kids if you're in the hospital, I'm really encouraging folks to have that courageous conversation with their family about what they would want to happen in the event that they can't speak for themselves. We often think about this conversation with our parents or grandparents, and that is really important. It is really important to have this conversation with your parents and grandparents. But it's also important to have this conversation for you. And this is called advanced care planning. So advanced care planning is making decisions about the health care that you would want to receive if you were facing a medical crisis. And it's not just about, do you want CPR or not, or do you want a ventilator or not? It's really helping the people around you better understand wishes. What type of treatment would you want? What are your personal values, and how do you share those with your loved ones? The steps to advanced care planning. So the first step is identifying a healthcare agent. Who is that person that you would want to speak for you if you couldn't speak for yourself? It might be a spouse. It might not be a spouse. Some people don't want their spouse to be burdened with that decision. It might be a family member, a sister, a parent, a child, a good friend. If that person is not your next of kin, then you want to make sure and put it in writing and make sure that that person knows that they are the one that you would want to speak for you, and that other people know that they're the one. So there's not any arguing if something were to happen. Then you want to make sure that they know your wishes. And so that the healthcare agent who's speaking for you isn't speaking for themselves, they're speaking on behalf of you. So you want to make sure that you are clear with them on what you would want in the event you can't speak for yourself. Beyond making sure that everybody else knows who this person is, and then you want to talk with your doctor and complete any necessary forms. And there's a few resources that can help you have this conversation. One of them is called mydirectives.com, which is free. You can go online and it helps guide you through the process. There's also good information there about just how to have the conversation and things to think about. 5wishes.org is another one. That one there's free resources, and they also have some resources that are available for a small fee. It's a very minor fee, $5, $10. And I also would encourage you to Google CDC and advanced care planning. There's a lot of resources there that can help to have those conversations. I think a lot of times we wait till it's too late to have that conversation. It's a hard conversation to have. There's no good time to have it, but the worst time to have it is when someone is really, really sick. It's something that you want to have thought about ahead of time before you're standing around an ICU bed.
Right. No, and thank you. And I remember during my divorce, it came to me, I was like, I need one of those. And, I went and talked to somebody and then talked to my sister who's on my advanced directive for that stuff. Because I was thinking like, well, what happened to my daughter? I'm a single mom. What happened to my daughter? And so,
Mm-hmm.
and having those conversations, and you're right. Because, like for me, like in the Black Caribbean community, they're like, you don't want to talk about death. So you don't want to talk about what happens to you. That's like taboo.
Right.
But it's important and the responsible thing to do to make sure that my daughter is taken care of when I'm in a place and I can't take care of myself. So it's just, one of those things that as a single mom, I had to think about that sooner rather than later. It just hit me. And I was like, oh my God. And I felt this urgency
Yeah.
and I had to do it. So for our families who are watching this, I think it's important that, to have, like you said, that courageous conversation around just to make sure for our families what happens during this time. So thank you for giving us the information and those resources. And so my last question is that there is a lot of misinformation and misconceptions about why people need to wear a face mask right now. So, I mean, you're seeing people on it, people don't, like what's going on. So can you explain why people should wear a mask when they're out in public?
Yes, masks, wear them. Oh my goodness. I'm so glad you brought this up because it's just, more and more as restrictions are starting to loosen, I'm seeing people with fewer and fewer masks on. And I just really want to encourage people to keep up the masks. I know it can be difficult. So let's start and just kind of go back a little bit and talk about the different types of masks, because people hear about this all the time. N95, KN95, what is all of that? So the first is the N95. The N95 mask has a very fine filter and protects the wearer from most viral particles. They are in very limited supply, as I'm sure you've heard, and they really should be reserved for healthcare workers. They are supposed to be tested, although just because of the supply, they haven't been doing that as much, but the filter is so fine that they even block out a lot of smells. That's how you know it's fitted correctly, is because there is something that's very pungent and you can't smell it. The next type of mask is a surgical mask. They filter out most particles. They're not quite as good as an N95 mask, but they also should be reserved for healthcare workers because of the limited supply. Then you see these homemade masks. They mostly filter out larger particles. Some finer particles can get through. I've seen some, everybody's sewing different masks, and there are filters that you can put in, like a vacuum cleaner filter that helps it to, filter out this even smaller particles. But the important thing to remember is that with the homemade masks, the importance of them is really to protect other people from you. It's not so much to protect you from other people. So the N95 and the surgical masks are helpful in preventing you from contracting COVID-19. Because they are in such short supply, we're not recommending that the general public wear it, but what really makes a difference in the spread is that wearing that, even a cloth face covering, keeps me from giving you the virus, right? And so when you think about being out and about in the world, if somebody has the virus and they don't have a mask on and they're coughing and spreading it, oftentimes they don't know because they're asymptomatic, and we found that people without the virus can still shed it before they have any symptoms. If you put a mask on them, the chances of them transmitting it to you or anyone else falls down a lot. Don't have exact percentages, but it falls down quite a bit, even more than if you have on the mask. So if you were standing side by side and they have the virus and have on a mask and you don't, then your chance of getting it goes way down. If they're standing beside you, they don't have on a mask and you do, that doesn't actually improve your risk that much. Part of it has to do with how you put it on, right? So you put the mask on, and I see people they're touching their mask, they're adjusting their mask, they're touching it. You should think of that mask as being covered with viral particles. When you get home, you want to take it off, you want to wash your hands immediately, you don't want to touch the outside of it. If you're wearing a mask and like touching it and readjusting it constantly, then it's kind of defeating the purpose. So keep that in mind when you're wearing masks.
Okay, thank you for that. Because I go like I was in a drive-through, and all of a sudden I was pulling with the mask on, and it didn't cover their nose, and I was like, okay. I
Yeah,
was like,
before that,
like talking about proper usage of them. My dad works in a grocery store, so he has one that he wears. They have disposable ones that they give them,
yeah,
because he's in contact with so many people in the store to make sure that, and everyone in the store is required to wear one. So they come in, they can't pass it to him. He's wearing one, he can't pass it to them. And so it just helps to make
exactly.
all of us safer.
It
So,
does. It really does.
right. So thank you for that. So that's all the questions that we have today. So I do want to thank you, Kisha, for your time to be with us today. And we want to thank our viewers for joining us for Waymaking. To send us additional questions and topics to discuss on the show, please visit the link on your screen. Also, please go and search for additional Waymaking videos on our YouTube playlist. And please join us next time on MCPS Waymaking.